I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
This time we'll roll call. Commissioner Reevy.
Here.
Mr. Brooks. Here. Commissioner Willie. Here. I'm here. Mr. Purdy. Mr. Kerbal. He's on time.
Here.
Mr. Purdy might be coming in a little bit late, so. Is there any changes to the agenda that anyone would like to make? Amendments to the agenda? Hearing none, as for move the agenda as presented.
I would move we approve the agenda as presented.
Second. Been moved second to approve the agenda as amended or as presented. All those in favor? Aye. Aye. Hey, any in-person public comment?
There is none.
Okay. Well, then, we'll do an introduction if we don't.
I'll go. Oh, I can go. I'll go. Okay, go. I yield. I love me.
The dodgeball.
Yeah, Monique's not here with us today, so I get the opportunity to introduce our new communications specialist, Shai Boyle. And Shai, help you to.
Yeah, so I come here with a couple years of experience with the Idaho Lottery in their social media and customer marketing specialist capacity. So I have a little bit of a background in public information and disseminating that. My favorite thing about working there was actually doing the Do Good program, which is a school program that gives back to Idaho schools and teachers and the Public Building Fund. So it kind of made the most sense to translate that here where I can, benefit public health and give back to my community. I've grown up in Idaho. I've lived here all of my life. I love how neighborly everybody is, even as we continue to grow. So I feel very blessed that I get to continue to support my own mission and my own values and also the community that I've grown up in and I love so much.
Thank you.
He was holding.
Come on in.
Oh,
Okay, yeah. Bet. You were in line. It's like Corona. Now serving number 22.
yeah, I could practice this ahead of time.
I'm happy to introduce Emma Skelton to our new, as one of our most recent nurse hires for our Nurse Family Partnership Program.
I think it's a wonderful program and I'm very grateful for this opportunity to be here.
Now it's my turn. This is Alexandra. She's our new organizational training and development manager. If for folks that remember, our prior staff, Sam Kenny, served in this role. She's moved on to a different position, and we've been fortunate enough to have Alexandra join the team. So
Thanks. I go by Ali. I'm from the Dominican Republic, lived in Idaho for 15 years and I love it. I came here from health and welfare. I was in the Medicaid grinder for the last 12 years.
and managed a team over there. So excited to come over here to do more of the stuff I loved at health and welfare and less of the stuff that pushed me towards a nervous breakdown. So
Welcome.
very honest of you.
Very nice. Thank you all, and thank you for choosing South Pacific Health for the great.
Thank you for having me.
Hey, has everyone had a chance to go through that Board of Health meetings? 8 minutes.
Mr. Chair. I read over these minutes and I almost joked when I saw that we didn't have a moratorium on budget increases for the next 2 years, because I just didn't remember actually voting to oppose a moratorium on budget increases. So I talked to Nikki and suggest we just change the wording on that because moratorium is very charged. So. Yeah, I thought we could maybe use the word offset instead, which articulates that we're using board committed funding to offset the increases that we're requesting from the counties this year. And we'll do it again next year.
You want to do the wording amendment or?
Well, I think that you have some just wording on that or. Yeah, I think we can just kind of swap out offset instead of moratorium in that. So I would, with that change, I would move that we approve the minutes as corrected. I have a question. I just realized that the item on the agenda is not listed as approval, but it does say approval of minutes. So it's listed as informational. But it does say approval next to it, so I don't know if that counts as close enough to action.
It's fine.
Okay. So I will make that motion. Thank you.
Anybody second?
I'll second it.
Okay. I'll second it. So, yeah.
Okay, it's been moved and seconded, and we're going to just change that one
Yeah.
word. Okay.
Everything was. Yes.
To approve the agenda with the changing of one word. Offset. All those in favor? Okay. Any opposed? Nobody. Okay. Motion carries. Move on to the next, which is Michelle.
Chairman, Hilton, if you could put up the budget, revenue and expenditure report. There you go. Okay, so the report here represents all the revenue and expenditures processed through our accounting system as of March 31st. And we're 75% of the way through our fiscal year. At the top left there, you'll see our cash balance was $732,774. And then underneath it are LGIP, operating, vehicle, and capital. And over to the right is our year-to-date revenues and expenses. And our month-to-date, you'll see that the revenue is 11.5 million. And the year-to-date expenditures are just slightly over those revenues by about 100,000. And as we look down the page there for all the programs revenue and their sources, there is a couple of things missing in this that we did not receive till the end of the month. The crisis center payments are not showing in there, and there's one county contribution. Both have been received March 30th actually, but that was too late to get it posted into March. So overall, the year-to-date revenues are 70.36%. So about 5% lower than where we would see them at our target 75%. They'll be more aligned next month. You'll see those revenues show up. Are there any questions on this first page, the revenues?
Do I have on the suicide prevention, we're at 109% of expenditures.
Oh, on the next page.
Oh, no,
Chairman,
excuse me.
revenue.
I'm sorry.
57.
Revenue's good.
It's actually pretty good.
It's over 100.
Revenue's good,
Okay.
yeah.
Good.
We received more than we thought.
Well, sometimes I don't read well.
Okay.
That's pretty good though. You're over 57.16%. I mean, 71.13, that we're in pretty good shape considering it's almost, we only have a couple months left,
Yeah,
right?
yep, we are. in really good shape. Yeah, so the next page on expenditures, yes, year to date, we're 71% of what our budget is. So I don't think, there wasn't really anything that didn't get posted, within March so that number wasn't closer to 75. I think we're just closer to the end of the year. Some of the contract payments get paid, so you'll see that percentage go up a little bit.
Something like the care inspections that's low, is that, why is that so different than what was anticipated? There's not as many providers?
Yeah, so this is a sub-grant that we bill health and welfare for. So I don't think that the inspections are down. It's just that we haven't
It
received.
can also be a timing. 'Cause, like, the inspections may not. We bill as we do them, and we may be busier. The same inspectors also do food and so
Yeah.
other things that are focusing on too. That we'll catch up later, but it's a good
Yeah.
question.
Yeah, I can follow up on that.
Vicky is correct. So it kind of goes in waves. So like this time of year, there's a lot more inspections as temporary permits and things coming up for events and things. And so it kind of ebbs and flows a little bit, but there's been no change.
Yeah, I was just
Inspection
wondering if that
daycares.
reflected some sort of a decline in providers or something.
Thankfully, no. It was not.
Okay.
Is there any questions? Any other questions on the expenditures there? Which one was that, Mr. Chairman?
WICHC is 97%.
Yes. The expenditures have been high.
Any questions? Okay. Agree. Next is contract services and grant application. Don?
Chairman, Commissioner, this is our update on where we're at with applying for additional funding from funding opportunities that align with our mission. There are a couple of changes that I would draw attention to that are on my handwritten sheet, but didn't get into the one that is in your folder. So the first one is under pending. That's listed as a grant for Pacific Source. The date there is 11/25. That amount should have been $35,000 rather than $50,000. And the good news is, rather on status under submit, we received a notification late last week that was awarded. So we're pretty excited about being able to bring that money into the mix and support the work. And then we have another change down under the gray bar. That first one under PAT NFP, that one should also be 35,000 rather than $50,000. So we were transferring our information update into a new format, and we miscopied a couple rows. But overall, I think it's good news, right? We have some more money there with that Pacific Source award that we were fortunate enough to receive this last week. Any questions from folks on that?
It's good though.
Yeah, that's nice. That's all I have for that one. Thank you.
Thank you. Any questions?
Question. This first one, the OJJTP, that's diversion grant, is that right? Is that similar to the one that we were looking at?
Over in the purpose column, it is for the
So is that
pre-sentence diversion.
is that different than the one that you had talked to me about?
No, I think it's the same.
Because that one, we're not applying for that one. That was bigger. I thought that was 700,000.
That's like, check with Michelle, we've had 2 or 3 from the same funding source that have come up that we've been talking about.
Yeah, I honestly can't get them all straight.
I need to ask what is, oh, maybe I got it already. Anyways, I know what, I can see what it's for. I just wondered what OJJ. That's good enough.
It's at the federal level.
I figured it was some justice in there somewhere, yeah.
Sorry for the acronym.
So,
Word soup there. We should spell it out.
They take a lot of space and you roll them out.
Why we have acronyms.
Yeah.
Any questions? Move on to police.
This one's a scribble from.
Yeah, on the vehicle leases, we had brought forward a proposal when we were talking about use of committed funds, that we had asked the board to approve our use of some committed funds carry forward to purchase some new vehicles this coming fiscal year. That was when we were in our preliminary discussions with the leasing agent, and the rates were looking a little bit, it was more advantageous to buy than to lease. And from after the board approved that, then the leasing agent came forward with some improved numbers, which swung the needle back to it's more advantageous for us to lease. So I didn't want to proceed forward with, hey, the board said we could buy some things and we're just going to use it for leasing. I wanted to bring that back and have you consider, and if you had any questions with that approach, just to make sure that we did everything. So if folks are supportive of that, then we would amend the approval use, the approved use for that carry forward funds to include leasing.
Whatever's the best business case.
Yes, that's where we're at, is the leasing is the best business case.
Do you need a motion on that today or
So
an action?
It's listed as an action item if you guys need more information.
That's the big.
It makes sense to me too. Okay, so I would move that we amend the budget.
I think the approved carry forward use for those
You
funds
approve
to include leasing.
Okay, the approved use of carry
That's the
forward
best.
funds to approve leasing
Yes.
vehicles rather than purchasing.
I'll second.
It's been moved and seconded to approve vehicle lease approval, but so with approval of using reach money for purchasing vehicles. All those in favor?
Aye.
Any opposed? Motion carries. I know I jumbled that all over.
I got it.
You're supposed to know.
We'll fix it in a minute.
Just,
You got it.
you got it.
You know what
I got it.
You got it. I know. Okay. Next on the agenda is septic permit and accessory fees.
Yes, good morning, everyone. I believe this was also on the agenda last time. And I do recall maybe a comment from Commissioner Reeve asking why we weren't on the septic permit fee. We were asking for $950, and our estimated cost is $1081. And we said at the time was a good question, but we didn't want to go up too high. And then depending on what Central District was doing, trying to keep our fees in alignment. We have since learned that Central is increasing their fees. The staggered approach, and their first step is to go to 1070 for this coming fiscal year, knowing that our fees are around 1080. We thought then it would be prudent to go ahead and raise them to what we would have wanted to do. It would still be in alignment with Central District, given that we try to keep things as close to as possible with all the overlap between the counties. So we're asking to increase the septic permit fees to 1075 to cover the costs that we estimate at 1081. Also, we have a environmental health consulting fee. We don't do too many of these, maybe 100 hours in a year. I think it was our last year's amount. It also is at an $83 an hour estimation of cost. Was previously at 72. We did not amend this one before, but we are asking to go ahead and increase that up to 82, just to keep in alignment with that fee costs. And then finally, just as a note at the bottom, we are removing our fee structure for solid waste, given the changes in DEQ that we are no longer going to be. So we're just taking them off the list. And I think that is it. So any questions potentially about any of that?
Mr. Chairman? Keeping in line with the thinking or question that Commissioner Reeve had, why are we not going to 260 and 110-ish, excuse me, for accessory uses? Why are we keeping those lower?
We had. Oh, yes, we had also moved those last time from 90, 290 and 200. I kept those numbers in there just so you knew what we did last time, but I didn't put them in orange so you knew that they weren't changing. We had debated on doing that. It's not something we do a lot of, so it's not a big fee generator, but if the board was wanting us to keep all those things in alignment, I think there would be no issue from like our staff or worry that that would be too much. So we could certainly amend them to do that same thing.
I would be in favor as long as you have substantiation to back up why you got to the number in the first place.
Sure. Yeah, we have all that backed up. So if we wanted to, we could, I can change it on the list here and for you guys to like, I don't know everyone's thoughts on like numbers, but I prefer a little bit more round numbers. I think when people see like 112, they're like, $12 for the permit, it just seems kind of odd. So we could go 110 and 250. Yes, I mean, we'll just do things kind of in our normal pricing structure for things, but.
Well, I think at this point too, you've said what it costs us, and then what we're moving the fee to still doesn't cover the cost. So I think if we're going to state what the cost is, we should get pretty close.
Okay, so your preference is to go the 112 and the 260?
For 110 and 250. I think that's enough of a budge factor, but close enough.
Okay.
I mean, the other one's 219, so I think people realize that
Yeah.
based on something, as long as we can document that.
Yeah.
How do we make up the delta now? Where's the, if your cost is greater than your fee, how do you make up the difference?
Well, what has happened has really been about staffing. So when we do these numbers, it's assuming a certain
Full level of staff
and a certain productivity level. Over the last couple of years, we've been definitely running at a higher productivity level. And so we've actually come in a little above budget as far as revenue, just because we've been so busy. We do, and I think Nikki might be bringing this up here in a little bit, but we can bring it up now. We do anticipate that to slow a little bit, if nothing else, because we're losing at least one person to DEQ. So it's going to take some time to fill that, and that could cause some delays in inspections. It's Brandon. It's his last name. But he's moving on to a DEQ, and then we have also DEQ reaching out to a couple other of our inspectors, trying to persuade them to join them. And so we do have worries that if that happens, there could be a slowdown in our ability to keep up for a little bit till we can restaff. Hopefully that won't happen, but we do know for sure that we're losing Brandon. So I think in this case, we're not as worried about being over on revenue in the next year if we do have these slowdowns. But typically, to answer your question, we've been able to have a high enough productivity rate, higher than we anticipated, just because there's been so much work.
And lower costs. You had vacancies.
The other thing-
I would agree with Commissioner Brooks. So as costs increase, the longer you delay keeping up with those costs, the bigger the gap gets.
Yes.
And then you have a bigger problem down the road. So I think you ought to close it as close as we can without raising too much concern with your customers. But
Sure.
I agree. I don't think you should wait.
Okay.
This is the same issue we have in the counties where we don't increase fees every year for a cost of living increase. We wait 10 years and then we go, oh my God, we're $1 million in the hole. Well, the reason is it's compounded interest, right? I mean,
Sure.
you can't do that. So.
And to your point, I think that's what Central District has run into and why they've had to stagger them up now, because they were afraid that the jump was going to be so, shocking.
Unfortunately, we were all benefiting from that, and now we've realized that the costs are increasing.
Always works on both sides,
Yeah.
unfortunately.
Well, we're all also consumers and customers, so we.
It's better to should cover.
And taxpayers.
Yeah, exactly.
Should never be taken out of the taxpayer money into a fee. And I know we can't make money on fees, but we should not be taking general taxpayers' dollars to cover fees. It's a bad thing to do.
Totally understand. And we'll make those changes. Was there anything else, Commissioner Brooks?
What are accessory use? Is that accessory dwelling?
Yeah.
Valuations?
Yes. Yeah, correct. Yeah. So if someone's going to add, an extra mother-in-law suite, or, these days, everyone wants to add a tiny home,
Right.
or some extra Airbnb rental or something.
Is that to assess the current drain field and whether or not it can handle that accessory use? Or
Yeah.
is that for a new?
Well, it's to your first
Okay.
question, is to assess to see if the current setup is going to be appropriate to add either another line. So either if it's coming from a bathroom, from like a barn or structure, or from a smaller tiny home, or in addition to the home too, like it just kind of depends. And so they have to, it's not just the drain field size, but it's also the size of the septic that needs to be adjusted sometimes. And we go by bedrooms typically.
Right.
These others, the site evaluation charge that don't have a proposed new fee, some of those also are under what the costs are.
Yeah, it's funny you mentioned that. So this is definitely on me. In fact, our manager, Mitch, yesterday came to me and said, thinking about that, we should probably look at the site evaluation fee too. And I said, well, I didn't want to have more work for Katrina to have to reprint these because we already had to do it again. And I was feeling bad. And then I felt like we've been doing okay as far as, because we've been running high in productivity. But given the discussion and knowing that we're looking at other losses, the site evaluation is usually one of our more time intensive tasks, because we actually go on site and I wouldn't want you to think that it's just once, because oftentimes it's more than one time that we have to go out there and address things as we find them. So whether it's more test holes that need to be dug because we have to get another larger drain field in place, it can be time intensive. And then of course it's an average of costs, because it's one thing to go to Nampa, it's another thing to go to Hawaii, but it's we don't separate out.
So I would suggest reviewing all of the fees
at once and bring them all up to what you think the costs are?
Okay.
No reason not to do that. I mean,
No, not at all. So I guess we have two choices at this point. Some of the fees are not very impactful because we don't do very many of them. So changing them, we're only talking at, in the course of a year, maybe $1,000 difference at best. Some of them are much more impactful. So the septic permit fees is the most impactful fee because we do the highest volume of those by far. We're running around 700 permits. So it's quite impactful when we make a change there. The site evaluations, we don't do as many, but it is a high cost, high fee. The others, when we look at, they don't impact things too much. So I guess we could do this two ways. We could go ahead verbally. I can make the changes to the site evaluation. All the numbers are correct. There's no change to those. I updated those before the last meeting. Or we can table it and I can come back with a nice sheet with all of them addressed at the next meeting, whatever your preference is.
I just think we should do them all at once and raise them up to what they're costing us.
Would you
I don't
prefer
see any
that?
reason not to. It's a downside to that.
Really, there's no downside. The only time I guess if we had like a banner year, could be a downside where we are, running at 100% productivity and really burning through stuff and we end up with more than we expected, but it's a problem for the future. And it's really not something we want to sustain because that means we're going to burn out our staff if we keep a red line on them like that. So we would just look to hire additional staff at that point, which would then readjust the cost structure and leave that in line. I don't really see another downside. So is your preference then to bring this back for next month in a different format? We can certainly be.
And I think that gives you time to look at those cost drivers and determine which ones. I'm of the belief, I agree. I mean, I think we should not be running at a loss, right? So get close to the cost on each one of them or at cost and.
Okay. Yeah, for sure.
Especially, we're not talking a lot of change here. I mean, looking at the numbers, it's not significant. It's not like thousands of dollars. It's
Correct.
$10, $20, $30, $100.
If you're talking about the cost to provide service, the current fee.
Yes.
It's actually quite a bit more, but I'm not saying that's not, it shouldn't be what it costs. I guess I'm wondering is, it's gonna go up $500 and a lot of it is time for you guys to get to Adams County and
Sure. Are you looking at the solid waste ones at the bottom?
That's going away.
Those ones
This
are
is all
actually
going away?
Yeah.
Okay.
DE talking about that.
Service.
I thought we were talking about the.
Yeah, we're talking like 355 and 300, 826 and 800,
Right.
155 and 150. I mean, it's not earth shattering.
Sure. Yeah, and again, I don't know, I try to look at some of the pricing just as from a consumer's point of view and the psychology of it. So again, the fudge factor of $5 here or there really is not consequential at this point, but I will readdress this and have it prepared for us for next board meeting. So if we can, I guess, hold this action item, and we've got time because we're not going to implement these fees until July 1 with the fiscal year. So that will be, and we can change the fees on the website within a day. So we've got.
I guess I would ask if you're running at excellent productivity and you're bringing in so much revenue, then maybe these costs are not accurate.
Correct. It's a good question. One, we are going to be down on productivity for sure because Brandon's last day is this Friday. And so we have a job opening posted, but it's going to take a little bit of time to train, fill in and train. Two, it is not our preference to do that. So that's really pushing the guys hard. And that's not our preference. So I think last board meeting, we have also approved another additional staff member. And so if we think that it's going to continue that way, then we had your permission to go ahead and hire again, which would change the cost back to what we would anticipate. We haven't chosen to that one because it's difficult to train two people at once, knowing that Brandon was going to be leaving us. The capacity to train two at a time is difficult for a smaller team. There's not really anybody else with those experiences unless they're coming from another district and already has done it, which doesn't happen very often, or which are sometimes from Central, but they're all been there a long time. I don't think they're going to be making a change over here. Two, we didn't want to initially hire just because of some of the other budget shortfalls that we've been having. So we didn't feel comfortable until we knew exactly where funding was all gonna shake out. But it's on our list. I believe, I think we said we were going to reevaluate mid-year and see how things work.
The other factor that changed in this team was that we're not doing solid waste anymore, and that was consuming about a quarter of Mitch's time. And we are also not going to be doing nuisance complaints for open dumping and tire piles anymore. Those DEQ wants to take those over. So that we'll see. We're skeptical that we still won't be pulled in on this because there's still a public health issue too on some of them. But yeah, so until some of that really, we won't really know like how that impacts staff demands until the July 1.
So Mitch has definitely been in the field a little bit more. Nuisance complaints definitely keeps him busy anyways, but he's going to be assisting with subject applications and things too.
I'm glad to know we can direct them towards DEQ. Because we get them all the time too.
Yeah. But I
They might
will,
not get answered.
I will do a thorough look at all the costs, to make sure that numbers are accurate, and then I will reflect them on all of the structures and then bring it back for our next meeting. Okay. Thank you for your input. I appreciate it.
Thank you. Any other discussion? We'll wait till next month.
Yeah.
Move forward with this, okay?
Yeah. Thank you.
Hey. There is employee compensation request, Julie.
Hi, good morning, everyone. We're moving right along today. It's nice. So I'm here to talk to you guys about our change in employee compensation request for fiscal year 2027. And so in your board packets, you have all of it right there in front of you. I'm not going to ask you to read it all, but I will kind of summarize it for you guys. So essentially moving into fiscal year 2027, we're requesting a flat 25-cent increase across the board and a 2.25 COLA for all employees hired by June 6, 2026, and who are not on a performance improvement plan. And that would take effect into fiscal year 2020. That pay period. The intent of that quarter flat increase is to really provide greater support to those lower wage earners, and the combined outcome of that quarter and 2.25% increase comes out to 2.6% cost of living adjustment or wage increase for the health district. With that, our request is to approve that if you are so agreeable, and to implement this beginning the June 7th pay period, with that pay date falling in July, which starts the new fiscal year. The cost of this increase would be $235,655.48. If funding supports, we would like to also request the potential to early implement as early as May 11th. That would be 2 pay periods early and resulting in about $18,000 additional costs. So with your approval on that, we would work with Michelle to identify if there is budgetary support to do either 1 additional pay period or potentially 2 additional pay periods early for that increase. We're asking for a COLA again, as we have the last couple of years, because our performers continue to stay in those top 2 tiers of high performing. We are still wrapping up the 2025 calendar performance review summaries, and so I don't exactly have that exact data for you of where everybody fell, but I suspect, just based on my looking at it, that they're all following the same 2 categories as we always do. Exemplary and meets most or all expectations. Because our budget is at that 2.6, differentiating between that for those top 2 tiers really means that we don't have as meaningful differentiation motivating those employees. That's why we're asking for a COLA versus a merit increase again another year. And then my request, I'm going to pause there. Any questions?
immediate thoughts.
Are you seeing the two additional pay periods as kind of a bonus?
Yeah, a little bit. It's really, from like an employee perspective, when we get our performance reviews at the end of the year and we have to wait that 6-month period to actually see the benefit of that performance review, and then we get it approved usually here in April, having that a little bit early bump is just, it's just nice. It feels good to employees to receive it early. Yeah, I see it as a little bit of a bonus, a little bit of a perk.
Yeah, along that same line, has this structure been proposed to the employees? Do they know this yet?
It was mentioned in our news you can use that we roll out to all staff every Friday that we were going to be making this request. The early implementation has not been shared. This will be the first. All of them are hearing our request, but what we were asking for has been mentioned to staff.
And is your sense that people are satisfied with that level of COLA increase? Does that seem low for the recent years?
I feel like it seems low as compared to recent years. Given the funding structure that we have this year, it's probably the realm that we need to stay in, but it does feel low. I would like to think that the general consensus from staff is that having this would be meaningful to them to help retain and build and acknowledge our workforce. Yeah, probably a little on the low side, what we can do.
We originally ran a couple different scenarios with some higher percentages, but we were concerned about sustainability with it at that, maybe more 5%, 4% level. We just had some concerns about the color of ink that generated, and so that's why we were bringing this forward.
If you look to, Don. If you look to page 2, there's some justifications in there. So US inflation is holding at 2.4% right now. Are looking at, and so the 2.6 is kind of in alignment with the average inflation. Also at that market data, most employers are planning to offer 3 to 3.5%. So the 2.6 is just right under that in terms of staying competitive to retain that staff.
This inflation number was undoubtedly generated before the gas prices went up.
Yes, it was. Yeah,
That's a big difference.
it does.
Who knows where we'll be at the end of the year.
Yeah, that's for sure. And of course, we're shooting for the COLA merit increases to help prevent turnover and retain that staff. Turnover typically costs about $36,000 per year on average, and then when you do get that new person in, it's usually about $4,700 to recruit that person, get them on board, and then of course another additional $800 to at $10,000 to train them depending on the position they're in. So like, Ben was talking about losing Brandon, and he's an environmental health specialist too. So in order to replace him is getting an underfill that could take a year for them to get to the level of it too, and a lot of training involved in that. So just on the timeline of replacing Brandon, it could take us a year to fully get somebody in at that speed. So,
Mr. Chairman, I can support the presentation if it begins on July 1st. I think doing it early, I understand the sentiment for how it makes people feel, but a budget was approved, and I think it's kind of a bait and switch or a little bit of a lack of transparency if we say, hey, we're going to approve a budget and then give people this much money, and then, oh, by the way, we're going to give them a little more at the end of the budget that was not part of the original budget discussion. And maybe I'm a little scorned about that because that had been the MO for Canyon County prior to my arrival and Chairman Holden's arrival. There was a lot of that going on, so we had to get things under control. We no longer allowed that. So.
I was gonna ask, did you look at other ways to do like a performance bonus? I mean, you took that same amount of money and provided small performance bonuses to your folks that aren't fully burdened? It might go even farther.
We have actually done that. in the past.
Changing, and I agree with Commissioner Brooks. I think you set a bad precedent if you implement raises for a new FY before the FY even begins. I just don't think that's good business. But there might be other opportunities that come to the board and ask for performance if you implement it. And if all your employees are in that top tier, it would maybe affect the same type of appreciation that you're trying to accomplish without starting the budget early.
Yes. Yeah. Fair. And we have done that in the past. We've not always done early implementation. We have a couple of times in the past few years. We've also done like one time. I think it was about 3 or 4 years ago, perhaps. Yeah. Yeah. And that was back when we were doing predominantly merit increases, back when we were under Department of Human Resources through the state of Idaho. So a little bit different of terms, but we also have done in the past one-time performance bonuses with the salary savings that we might have had for the current fiscal year to honor in the same way. So we could always explore that as well. There was budget support for that.
I would agree. I think if they get a raise 2 months early, then next year, if you're back on the regular fiscal year, it's like, I haven't had a raise in
14 months.
Yeah.
Very much true. Yeah. Okay.
I would second Commissioner Brooks.
Okay, fantastic.
How's that?
Yes.
Okay, we have a motion and a second to approve the county increases.
Employee compensation.
Wow. Increases.
Mr. Chair,
That's the next.
I know that I mean,
another question. I'm assuming that this compensation is what's in the budget, right?
Yes.
That we're going to.
Yes.
Just making sure.
Can I make one more question comment before we move on? That your comment about instituting this 2 months early assumes that there is money sitting there in the budget, and we didn't talk about that.
Right. No, that's why I wanted to leave it very vague that if there was budget support. So I'm not even 100% certain at this moment that there is budget support to do early implementation anyways. When Michelle and I were chatting last week about it, we need to get the budget approved and look at everything before we can even decide if that's even within the realm.
But this would be out of this year's budget.
Yeah, the early implementation would be out of this year's budget, and so that additional 18,000 would be this year. So yes, Dr. Brooks is, yeah, she's at this point. Perhaps we can look at using it in a different way. Should we identify?
Should you
that there
identify?
is
So that's
funds available?
quite premature.
Yeah,
Okay.
that was my excitement. My apologies.
Okay.
So yes, if we could do at least July 1st implementation, that would be.
But I do agree that losing people, having people recruited away, compensation here is a problem.
It is hard to stay competitive.
We will. Some counties suffer greatly from that.
So where are we with this motion?
I think the chairman is going to call for a vote.
We're moving to approve the new employee compensation structure.
Yes.
Structure just to increase employee compensation.
Compensation to, which will be 2.6 or 2.25 increase with a 25 cent flat increase. Heard as of June 6, 2026. Any further discussion? Hearing none, all those in favor?
Aye.
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 Motion carried.
Thank you for your time.
Thank you. Next on the agenda is county contribution request.
Apart from Michelle, are there any other questions? So you want to go to the budget book? I'm going to, I'm not going to go through all of this. since you saw it last month for the most part, but I do want to call your attention to a few things. It's like, I'll start at the beginning, like, I'm gonna skip some pages, but, first, I wanted to call out on page 2 that our overall budget total, request, 15,758,411 is, less than what you saw last month, and that's because Michelle and I discovered that our 27th pay period isn't this fiscal year, it's next fiscal year. So we're glad we found that.
Yeah.
We'll be ready for next year. So without that additional pay period, it dropped down our total budget request and the increase, well, decrease from the prior. And then going to move on. So all these pages in between should look familiar, but I'm going to go to page 11 and just talk a little bit about, again, I don't think these have changed. These pages have changed since you saw them last month, but as our FTE changes over time, competitive population and budget, and then we did increase our communications specialist from 0.05 FTE to a full-time FTE in this budget. And as we talked about earlier, we're holding off on filling the environmental health specialist position that we had originally considered putting into the budget. Also, an additional counselor until we kind of see what happens as the fiscal year plays out. And then kind of because it's probably a large sum of money that we'll be looking to pursue, I did kind of leave a note here just as a reminder that we are working on proposals for the Rural Health Information Grant when that notice of funding opportunity is released, which we expect will be sometime in May. And move on to the county contribution detail on page 14. And I'll draw your attention on page 14 to the population data, which was not updated last month because we didn't have the data yet, hadn't been published. The census has been updated, so you now see the 2025 data and what that change was to the prior year and how it how it changed for your county. That's the data that then is put into the formula that is outlined in section 39.424 Idaho Code. You can see that at the top of page 15 in very small print, but that's how the formula is applied to our county contribution request, which is a 3% overall increase. At the changing county contributions are summarized at the bottom of page 15 with what was approved in the current fiscal year, what our request is in fiscal year 27, and then at the board's approval, we have the adjustments for what will draw down from board committed funds to offset any increases to counties in the next fiscal year. But those of you that would have seen a decrease, you'll see those decreases. So you'll either stay level or have a decrease. And then in the last column, the kind of tan column is what our request is with that offset.
Not moratorium.
Right.
So
I'm glad you're scared of that word.
So I can pause here if there's any questions. We can also come back to it, but I had a couple more things I wanted to show you in this packet. So maybe I'll move on for a second and then come back to that since that's really the meat and potatoes of our report.
But it's quite, the population has actually gone down, Jen. Is that? You feel that?
No. I don't. I don't know that we've gone down. I think our percentage may have gone down because others are growing faster than we are.
Well, this is the population number.
Yeah, I don't know where they got that other estimate at.
It surprises me too. I've seen that like every year, one county has decreased in population, and for a while it was
Maybe
Washington.
it's how they count. I certainly don't think we've gone down.
Doesn't make any sense.
I don't know.
In 2020,
I can give you some of ours.
Well, that's why I said we're not going as fast, but we implemented a comprehensive plan that limits sizes of locations of subdivisions, so it helps manage the growth, but it's still a growth.
in
It's a small.
2027,
Here we subdivision.
well, there's gonna be between home and home, there's gonna be about 150 miles going in, 300 more people. 1 year.
But in 2025, you said you got.
We lost population.
Well, oh, maybe we did.
Reasonably population.
They need to stop. One of those things, subdivision with amenities.
What was it?
Yeah, housing on ag land, we have a couple of really big dairies, they buy up everything, and, they just tear down houses. They're in farming,
Nice. I like that.
even though the grounding ain't good, they still do it, so. So we, that part, but I can guarantee you in 2026, 2027, it's gonna go up. They're at 500 new homes in Homedale, well, in the next 5 years. If the
It's
economy
interesting to
continues
see what happens the rest of this year.
Following pages, for that, if you want to, but I just wanted to draw your attention to the following pages are by division, just a summary of some of the budget highlights. And I'm not going to go through them, but one of the questions that Commissioner Willie had at the last meeting was if in the table, it looks a little differently because we broke it into sections based on kind of the division, but he asked if we could add like what the district's support is to the program areas. So that is added into these tables at the last column on some of them, like in mine and Dawn's teams, and then it's kind of squished in there on the direct service side of like Ben and Beth's teams, second to the last column, because we've also tied into some program metrics from fiscal year 25 to show kind of what we've done, where we had quantitative data. So, make sure you saw that and for your. I addressed all the input questions from the last board meeting, but if you'd address any questions further or we had more questions around the county contribution request, happy to entertain those. We do have the county contribution listed as an action item on the agenda. We also have the fiscal year proposal review listed as an action item. I don't know that we need 2 action items, but they're on there. So do everything in one potentially or one.
from the county, the contribution by county, since our request is equal to 27 county request, shouldn't you adjust for draw from the board be 0?
Michelle, like this went down, right? So remind me how we calculated.
The gem one went down.
So if the 27 request is
It's less.
$200,916.
Oh, yeah. So your overall request is going down $449,
Right.
Yeah,
But for FY27, you're not adding anything to it, right?
correct. It's only going down. So either if your county, once the request went through the formula, if your county's contribution decreased, then we honored the decrease. If it went up, then we kept it level with FY26. So your county request to you would be less than what the county contributed in FY26 because overall, after the formula was applied, it went down. And so the 449 is us absorbing that decrease that you won't be paying, that we'll be pulling out of our board committed funds.
But isn't that decrease absorbed up here when you do the calculation based on population growth by the other counties? Because now,
It would normally, so normally without the board committed funds, yours would have gone down and others would have gone up. So it's not like everybody pays at 3%. When we request 3%, the 3% is this total that's been run through the formula. And then depending on your property valuations of population changes relative to the other counties, it's going to be somewhere above or below 3% generally. So how we're absorbing that with board committed funds is for those that saw a decrease in our county contributions, we're pulling from our board committed funds to absorb that decrease. And then for those that increased, we're taking that increase out of board committed funds to keep you at what you were last year. It's really good practice for one of the counties.
well, I still don't, the logic doesn't.
Uh-oh.
That's my,
Okay, need to be practicing.
no,
Is your bill not high enough? I can help with
no,
that.
no, it's not that. I was just, I'm actually looking at it from their perspective, not ours.
So
I
the
appreciate that.
Oh, you probably weren't here when this all went down where,
In 26 now.
well, when we changed how much we keep in fund balance. So there's a pool of money out there and then that's what they're gonna pull.
Board committed funds. Yeah, so it's, we, that would bring, we should have the committed balances. So we do have, oh, do you have it with you? Do you want to just talk about it maybe a little bit?
Yeah,
Well, we're going to start presenting this in the board.
yeah, we'll add it to the revenue expenditure. So at the end of the year, each fiscal year, there's certain programs that have dedicated funding, which means they've gotten a specific funding source, general funds or something that is used only for that program. So we bring that to the board and you guys approve that, yes, that's good to keep that balance in as we call those restricted funds. So they're funds that aren't spent at the end of the year, that they can spend the next year. And there's also a committed fund, which is things that we ask the board to approve for use of other things. So such as the vehicles that Dawn mentioned. There's remaining funds at the end of fiscal year. Then you guys approve where they go, like what categories they can be spent on. And we bring something to you to approve, but then you can approve it or suggest something else. And so that's kind of how those funds sit there. And then we just draw from that balance.
So you're taking your uncommitted funds and putting them into a reserve account.
Reserve, there you go. Yeah. The reserve is the committed funds. Yeah.
And the board's kind of how those funds
So
should
why
be
don't you call it
used.
reserve?
It is, yeah. Well, we kind of,
Just ask.
because we kind of, just, they're committed, so they're not available as a reserve to spend on anything.
Oh, yeah.
They're committed towards a specific use.
Typically, reserves are reserved for specific uses.
Yeah.
Capital improvement, capital replacement, et cetera. So it's like the same problem in my county. We called it depreciation on our budget. I'm like, why?
No.
That belongs in your balance sheet. It doesn't go on your budget. So now we call it capital asset replacement fund, which more properly reflects what it's for.
Exactly.
So, okay. I still don't get the math, but I'll.
Keep practicing. Because if you're having a hard time,
Yeah.
it's gonna be harder for other people who are board members.
I guess looking at this bottom table, that's maybe a little bit confusing because this is adjust for draw, so they're not all adjusted by drawing that money out of them. The ones that went up are adjusted down, but the ones that went down are going down.
Right, yeah, this is.
Yeah,
Well,
so
we
this column is maybe confusing to me.
Yeah. Well, and I think we talked about that too, because that's really, maybe it shouldn't be in this table.
Yeah.
Maybe it should be somewhere else, because this is what the district is pulling from committed funds to pay, not like the difference that we're making up, because otherwise some of these would have little
Right.
brackets around them.
Exactly.
So is the budget request for 27 what's in this FY 27 column?
Yes, that's the total budget request, that the 3% increases to 98,000. Correct, Michelle?
That's correct. Yeah, and the 27 column should match the first column, the 26 approved county contribution.
Yeah.
Except for the 2 counties that went down.
I want to give this another step at it. This is the request,
Right.
right? For the, 2 counties that are going down, your downward request amount is being reflected there. For the rest of us that are going up, and from the committed funds to make up that difference, so we stay the same as what our current fiscal year is.
I got it.
Can you come on my roadshow with me? You did that in like a quarter of the words I did.
For a small fee.
Chocolate always.
Okay.
I'll work on the math and let you know.
Well, we can definitely present it differently.
No,
This, like, pull this column out, because I do want to make sure it's clear to the other commissioners when we're presenting. And it is something we haven't done before, so even for those who've been around a while.
Any more discussion?
Yes, this is an action, and I wasn't sure how best to, I didn't know if we needed 2 action items on the agenda. Sometimes I feel like we have the county contribution request as an action item, and then the board doesn't really feel like we need to approve the overall budget because of the potatoes of it. So we could do two actions or an action item. That's the board's appetite is.
So I would move that we approve the fiscal year 2027 budget proposal review, including the county contribution requests.
Accurately reflect.
It's been moved and seconded to approve the fiscal year 2027 budget proposal review and with the county contribution request. Any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Motion carries. Good break. We'll take a 10-minute break. Good.
We want real tough.
Yeah.
Yeah.
I got plenty to do.
All right, thank you. Makes it easier. At this time, we'll move on to the executive council update.
If everybody's gonna do what, I'll start. So in your packet, following the budget is just a summary of, bills. It's a two-pager. The first page is the bills that were signed by the governor that public health related. And then the second are ones that didn't make it through. And I thought I'd maybe just talk a little bit about a couple of those that have impact to operations, on the ones that were signed by the governor. And one, as you all already know, solid waste, will be moving to DEQ starting July 1. We met with the public health directors, met with the DEQ director a week or two ago, and their intent is to hire 2 or 3 positions to take over solid waste for the state starting July 1. And then they also, as I mentioned earlier, intend to take over all complaints regarding open dumping and tire piles. I think internally we have a little bit of concern on that will actually happen, but direction has been to send any complaints that we have received to the regional DEQ office for our district, and they will be responsible for following up on those nuisance.
Is your understanding that DEQ will contract with the health district to do solid waste inspections?
They are not.
They're not going to.
They discussed that early on.
I didn't see it in that legislation, but I thought.
In the legislation, I think it said they have flexibility to do that,
But they're not.
but they're not planning to. Yeah.
If we don't bureaucracy, government at its best.
Top down.
We just love it.
I do have a little bit of concern about what will happen with the open dumping and tire piles and what kind of time it will get in responses from DEQ. So I just suspect that we still may end up being involved to some degree just to be responsive and helpful to the county's community, but we'll see how.
Are they gonna take care of all the illnesses that come from clearly? Mosquitoes and that. They're gonna be taking care of all that.
No, they wouldn't be taking care of it. So there's still a public health aspect to some of this, for sure. Especially since we have rats apparently.
Yes, we do. Oh, she has, right?
Keep them on this side of the hill.
Yeah.
I thought they were illegal.
They are. And they're spreading into Boise.
Yeah.
Okay, so I wanted to bring your attention to that one, and then the other one that has impact on us is Senate Bill 1283, which is the direct consumer bill, which operationally we're still trying to figure out. We're waiting for some direction from the AG's office because it kind of deregulates cottage foods and also. It also kind of it kind of regulates, I guess, low risk establishments that we determine low risk, which currently we haven't been inspecting, and that might be like snow cone back or another good example. Like a donut thing. I don't know if donut's the right one, but snow cone. And so those are, as we deem low risk, we haven't inspected. They've usually just kind of come through us, and we've been like, give them some education, and they don't need. But now, under the law changes, it looks like we're supposed to inspect them, but we're not supposed to inspect cottage foods. And in the past, individuals who were doing cottage food had to use a commercial kitchen. They can now use their home if they're doing direct to consumer to foods. And then there's some like education that the department is responsible for providing, but we don't really know. There's no like process built in for that. So There's just some unknowns. One thing that we're kind of encouraging people right now, especially since we're still trying to figure out the implications of the law changes and it went into effect immediately, is just how to best give producers the guidance. So that now, I don't know, Ben, if you have anything to add.
No, I don't
Impact
think
of
so.
team.
The impact is still unknown. I think the team, obviously, as general, is a little bit frustrated because they don't like the lack of clarity on what they're supposed to be doing and want to do the best job they can. So that causes a little bit of frustration, but I think our manager, Jeff's done a good job of framing, reminding that we're just here to keep everyone as safe as possible, and we'll do that, whatever bounds that we're given. So we're attempting to work the best we can with our cohorts in Central too, to make sure the messaging is all the same, because we got a lot of vendors that cross border Canyon County, and so there's a lot of moving parts, but I think we'll get to it and do a good job still.
Income threshold on that?
That was a different piece of legislation. Yeah, I think it was 5,000 or something. That one did move forward.
Impossible to determine.
Yeah. Yeah, and then this one, I think, like, kind of deregulates any kind of meat processing, except for chickens over a certain number.
Yeah, I think it's over 1,000. Over 1,000, then it was still, then you had to go back into the old rules. And then, yeah, you can do like sausages and different things like that too, that was previously not allowed without permits.
Molly's on the Trump year.
Molly's is now okay. So as long as Target doesn't mind, I'm in the parking lot, sell away. Just can't prepare it on site. That's all we done at home. Yeah, and no samples. That's the other thing that's a little nuanced. The sampling would be technically preparing, and so that puts a little wrinkle in the what's in the pool and intent of it.
Well, Mrs. Norby has great tamales, and she just travels around town and sells. So
I would like to point out that I have worked in the home health arena for many years. There are many kitchens that are just fine, and there are a whole bunch that you do not want to see. So, buyer beware when you're buying from commercially producing places.
Yeah, but having a commercial oven doesn't change that.
Right.
No, not
Just
that,
because the type of oven you have doesn't mean it's a clean kitchen.
the food handling practices. that
Right.
the most
I agree.
temperatures.
wagons are really good.
That's true. Might taste good.
You're on a permanent cleansing.
And
I worked on one time, and I refused them pregnant in the hood, so let's just say that much.
very good iron stomach.
I couldn't.
I was disappointed that the Kratom bill.
Can you, before we move on, can you just, in 10 words, tell us what some of these are?
Sure. Emergency mental health first aid was protections for kind of like the Good Samaritan law, but for mental health instead of but expanding to include mental health. So protections against for those, and then background checks, health and welfare. I feel like I should refamiliarize myself with this one, but that one had to do with background check requirements for childcare providers in, I think, for children specifically called in the CPS, Child Protective Services. Harms of addictive social media. So there was a couple bills related to social media that kind of attempted to restrict access to social media for children. So that was one, and then there's another somewhere. I think it's the Conversational AI Safety Act also, kind of was related to that, where you have the AI has to provide disclosure that you're talking to something that's AI, like if it's a voice generated AI. That kind of like when you had your experience talking to SiriusXM customer service, and it was an AI. It was wonderful.
No, I'm kidding, I'm serious. Did it stop in the middle of what it was saying? You say, I am an AI?
I don't remember, but it gave me everything I wanted, so now under this law, and I have just a divulge that they're AI.
So it, like when you first open the app or something, it says you're talking to an AI bot and then you go on with your personal conversation with it.
Yeah, but I think this is more kind of maybe it's futuristic, because I only use like kind of AI for stuff. I don't engage in it like some people, from my understanding, are kind of using AI as like their friend.
To do everything.
Yeah.
What should I
Kind of
wear?
like
What should I put
Personal.
on the menu?
Yeah.
It's all.
It was initially easy to tell if, just because the voice quality and
Yeah.
text was off. It's now becoming increasingly difficult to tell if it's a real person or not.
Or even impersonations, right? Like I see a lot of impersonations of famous.
Critical figures.
Well, yeah, these memes that look real
Right.
and it's not.
I just don't know how you would be constantly identifying that. I don't know how you're gonna legislate.
Well, we'll
Get rid of my phone.
So that was that one. Solid waste annexation by cities. So that law intended for people who have property with septic systems and are being annexed into a city, like cities apparently can require under the current law to make them hook up. And this law says that can't do that anymore.
Staying septic and well too, I think, right?
About the well.
I think it's well too, which, what's the point of annexing? You're not gonna do that.
And that's been kind of interesting. Mitch has mentioned to me that there's been some different interpretations of the law, apparently by some cities on that. So there's a little bit of conflict, I think, going on. The parental rights medical decisions. So that was kind of a follow-up bill to legislation that passed 2 years ago that really kind of restricted medical care being delivered without parent consent. This kind of, I wouldn't say loosened necessarily, but it provided, it gave a little bit more clear direction on when it was needed and under what conditions, specifically around like, emergency type care, or like a situation where maybe sexual assault happened and things like that. Sex offenders in daycares. So under this law change, the daycare, currently the only daycares that were required to have background checks were licensed. This law says if you're running a licensed or non-licensed childcare daycare, that you have to have background checks. Direct to consumers, I mentioned the conversational AI, the Department of Health and Welfare legislation that eliminated the State Board of Health and the 7 regional behavioral health boards. The property rights protection bill, I don't know that really impacts us that much, but it, for government workers, it basically clarifies where, what you can go, where you can go on a person's property.
Right.
And the only areas that we thought that might impact us is when we get nuisance complaints, and we don't typically just wander around anyway. We try to stay door and just to look around.
Or ancillary property that's like public.
Yeah.
You can access.
Or neighbor property.
And sort of the neighbor invites us on. We would never just march on this property unannounced there.
Well, with drones now, you don't even have to go on the property. See everything you need to see.
That's true. They already do that.
And then the last one was just the appropriations bill that established kind of the sideboards for that rural health transformation grant and established a legislative oversight committee to help guide decisions on how that funding will be used.
And that funding had to be committed by October, I think.
And then I won't go through the next page of all the bills that didn't make it. Commissioner Ruby and I were talking about maybe getting together those soon to have a conversation about what we think might be priorities for the next session, so that we can start kind of working on position statements or policies that we might want to touch on. And we talked about Kratom maybe being one of those. To address, but I'm sure after we have a chance to talk, we'll come back to the board and is going to get some input from staff here as well. Today on matters affecting their different fields of work.
Is that what Mitragyna speciosa, is that kratom?
Yes. But that much more fluently, that's.
You know that State Department, the State Board of Health, you know anything about that? What do they do? I know somebody is on it, but like they were pretty non-functional anyway.
I'm not sure what all they do. Do you know that? Things are done.
I think they bless people coming into certain positions within some of the state agencies, but listen to reporting, but that's about,
Well, I think they heard appeals.
they may have.
And so now I don't know what that appeal process would be, but.
It goes back to the agency. There were some changes to the appeals process, I think that went through too, but I don't know if that had anything to do with it. Yeah, and I think they had something to do with orders as well, maybe like statewide orders. Even though they're signed off by the governor, I think the board. Okay.
Makes you wonder how important they were if you can just get rid of them and go on business as usual. That's why they got rid of it.
I have Commissioner Review, if there's something else you want to add.
I think that's pretty good. But I guess I would, speaking from my own point of view, I would like to go into the next year with some more ideas and maybe resolutions in mind, because it seems like, I mean, no matter what, if you're just blindsided by all of these bills, but it would be good to be ready at least with some issues that we're concerned about.
I thought about the rats thing too, because that's a public health issue. For sure. And it seems like something that some of the counties are really, cities are really grappling with from an abatement perspective. And then like Canyon County might be next.
Yeah, it was a topic of discussion at our last committee. The rats, vector control, that the rats were the majority of discussions. So it's an issue.
Yeah, got a lot of attention. I think they've always been there. I mean, rats live everywhere.
These are, you've seen one? These Norway rats are pretty.
What's the difference between Norway rat and any other rat? They look the same to me.
They look the same to me, but they're big.
I did notice the one on the front page of the paper recently was not a rat, it was a deer mouse. I'm like,
Yep.
I'm like this big. We're talking like this big. Come on, dude.
Don't have any, place for them to hide.
They're sending candidate surveys to people not even running. So
Oh, nice.
I'm not surprised anymore about the.
They had a conference, or I went to a conference on rats, and basically ended up just being rats so much. How they moved in here and are very prevalent in our city. Will never be able to get rid of it.
Right.
It's a never.
Yeah, it's not an eradication, you just have to.
And how, I mean, the places that they can go through,
Like,
that you don't, I mean, there's no way you would think they can go through there, but they had cameras watch them go. Places that honestly, even you think a mouse would get through, and these rats are getting through. It's amazing what they can do. And then how much they forage. If anybody, people that have their trash out, whatever, we should take the trash out just before the guy comes there to pick it up, because that's the favorite place for them. And they can climb right up on top of those. No problem. I mean, no problem. It was amazing. I watched that and I thought, well, I got pack rats out of my cabin, so I mean, I don't have to worry about them now. Anyway, it was just an amazing conference to watch the birds and how prevalent they are and how fast they breed. They are fast. Anyway, is Clearwater here?
Tina's giving me the thumbs up.
Yep. Well, it is right on time for Clearwater, so if everyone's willing to move on to that. Let's move.
Yeah, the Norwegian rats weigh more than a pound.
Yeah.
And they'll chew through a solid core door in a matter of hours. And so you have to put metal flashing up and the trim. There's a whole control.
Same thing under your soffit and fascia.
Yep.
They'll eat through a soffit
Yep.
if it's made out of any kind of particle board.
And they're so smart.
Yeah, they're very
dramatic.
If you put bait out for them, they're so smart that they'll look at it, they'll go all around it, they'll sniff it, they'll do all that stuff or trap whatever, and then they'll just go. Honestly,
They're
they are
really smart.
very
Oh, thank you.
creature. Oh, yeah.
Thank you.
There's that giant packet.
That's only, that's sand, the appendices.
Executive summary. Oh.
Thank you, Judith.
Yes.
Be quite a sleep day last
Awesome.
twice.
That's our purpose, but that's our goal is to, it's dual benefit.
Executive summary.
I am talking to Fulton right now. One moment, please.
So make sure it can be streamed where they can see.
Wait for a response from him.
Ready to start?
No, let's just wait a second. I want to make sure our live
I'm
stream.
waiting for my IT in the sky here to respond to me.
Your eye in the sky.
My IT guy. One of our IT engineers is our virtual moderator.
We're going to talk through some of the recommended path forward, and then please feel free to ask questions or offer some feedback as we walk through. We've built that into our presentation. Really want to be cognizant and respectful of your time and your schedule, your agenda today. So hopefully keep you guys on track and just move forward. So, when we started this process, one of, some of these drivers were why the plan was needed in the first place. So really helping to establish for the district its current status, looking at population growth across the district, 6 counties, looking at different demand for services, the abilities and capacities of the facilities within the district, and looking to align those into a direction forward that the district can follow, really a living document that can be evaluated each year, and priorities can be moved around, or new ones can be introduced, ones that might not be as prevalent or priority can be moved off. But really the plan was needed to help ground the district and where it's at, and then look at how and where it's going to be moving forward over the next 10, 15 years. We really used a 2040 planning horizon when this was put together. So looking across different times and evaluating needs and capacities throughout that. So our approach to the master facility plan, comprehensive financial plan process, bringing the facilities, operations, and financial pieces into alignment, again, looking at that 2040 planning horizon. But given the district's width and breadth, wanting to maintain the flexibility and that type of approach that the district is able to navigate changing landscapes, different counties, different community needs, as well as internally what their capacity is, their staffing, and how they should be planning and prioritizing. So really this plan is, the culmination of financial, facilities, and operational analysis to help drive some direction, and really understanding that these are public-facing decisions that you are all making, and wanting to be cognizant and respectful of that, as well as giving you something that, again, is livable and can be navigated moving forward for the district. Inside your packets, you got, I think, 83 pages, which is the actual report. The remaining 300 are all in the appendices in the electronic file that I think you all have. So if you didn't have a chance to look through those 300 pages, we're just kind of recapping on what's in there. But as this plan was put together and the report finalized, we really did look at multiple inputs to establish where the district is, what the community is looking for, what the community is aware of, where the utilization might need to be evaluated in terms of the population being served, and also the capacity of the district. So we started with our facility assessments. We were able to tour everything. We did department interviews. We conducted stakeholder interviews as well, so internal and external. So that included staff, and also included partners of the district. So we were able to talk with people in each of the counties to really get a feel for, they were given the same set of questions, but really get an understanding of what's the perception of the district. Do you feel like anything is duplicative? Is there any competition in the services being provided? What are you seeing as emerging needs in your community? And then that was part of the stakeholder report that you all received last year. And we'll get into what our observations were next. But we also did operational analysis, so looking at how did programs and the staff and the different facilities all work together. There's efficiencies or inefficiencies that might need to be looked at or possibly remedied. We conducted the community survey, which responses gave us one perspective, and then given the population of the district and maybe less of a turnout in the survey, also gave us some more really important inputs into the plan for ways that the district can strategize moving forward. We also had involvement in the Citizens Committee. So we had representation from each of the 6 counties. That committee was involved in reviewing everything that this board reviewed, and then ultimately issued a recommendation that is part of the appendices and contributed to the recommendations that are in section 10 of your plan. So at the very end of your packet, section 10, we'll get into those a little bit later in the presentation. And then the demographic report for the district, really important cornerstone for where the district is population-wise, income-wise, priority-wise, in terms of who's going to be utilizing the services. We looked at income, we looked at poverty statuses, and that report is foundational as well to the final report and making recommendations moving forward. I'm going to pause there. Are there any questions on anything so far? It's all like a really awesome measure. All right. Okay, so inside the planning process, this is just an overview of Clearwater's process. So initiation, analysis, planning, and then recommendations. This process really did include quite a bit of integrated engagement. And by that, we mean, as well as with regular alignment with district leadership, is not just going through our process, but taking our process and adapting it to the needs of the district, really working hand in hand. You know, it's sad that Sam's not here to see this culmination of effort, because she really was critical and pivotal in contributing to the progress of this plan throughout the past year. But we did have quite a few meetings as well with Nikki and Dawn. And so every step of the way, we really strived to keep we weren't working on our own, and the district wasn't driving which direction we went. It really was collaborative. And we were able to make sure that what we were capturing was not necessarily what the district expected, but what they anticipated could help feed the direction of this plan and ultimately the district itself. So going into key findings and what we heard and observed, again, these are our themes that we've talked about in our previous meetings with you. The awareness of services is inconsistent. So depending on the county, depending on the demographic, awareness of the full depth of service that the district provides is limited in different areas. So this varies across the district. So geographic access is important, and that can be a limiting factor in whether or not residents are choosing to reach out to the district for help. Sometimes it's a really convenient location. Otherwise, when you get into, even going into Owyhee County and you're crossing the bridge and you have a family that has one car, that those are constraints in access to services. One of some that we observed. Behavioral health demand is increasing. So across the board, we saw that come through consistently with the community survey, with our stakeholder interviews, as well as internally with our interviews. There is an increasing request and need for behavioral mental health support. So we wanted to make sure and clarify that inside the report, that it wasn't so much substance abuse or even prevention. It's more around the mental health side. Another thing is staffing and hours drive availability. So when we were looking at the awareness of services, limiting hours or inconsistent hours between facilities, that also contributed to lack of utilization or unawareness of overall services. And then the facilities themselves affect that service delivery. So looking at the resources here at the Caldwell site versus what might be available in Emmett or Weiser, whether that's a satellite location or maybe a shared location, whether it's privacy, whether it's access to the same supplies, same resources, internet, different things like that are contributing to different experiences on the consumer end. So those were our key observations, and I'll pause there if there are any questions or feedback about that. Okay. So, touching again on the geographic access that matters. There's a huge service area for the district, and that creates travel barriers, but it also requires the flexibility that the district has worked really hard to demonstrate across its locations. Really trying to meet the needs of its communities, understanding that what works here in Caldwell isn't necessarily going to work in Fayette County or Owyhee County. The rural communities really do rely on that flexible model to where service is not only offered in a convenient location, but also in a convenient manner. So the fit and fall classes that are happening out at the hub, in clinic services, those are ways to meet the needs of that community. And I think what everyone what we've learned through this is that there's no shortage of need in the communities for these types of offerings. It's more a matter of understanding how they can best be delivered and in what model. And then the physical presence, building trust and access. So that's something that emerged with the shift in location just very subtly for the Farmway location. So not being in that same site, but staying in the same proximity in the same area, that came as feedback from one of your citizens committee members, to where making sure that that community still had the resource and the access in that same site to maintain the trust in the service being delivered was really critical. So the district's presence and maintaining where it is, that not only lines up with what we've heard, but also with what we heard as an express preference from the board, that we're not looking to go buy a bunch of new buildings or move to, expand the footprint. More so, it's how do we optimize what we already have, really keeping in mind the cost impact there, but then doing due diligence on behalf of taxpayers who, are critical inputs to this as well.
Can I ask you a question?
Yeah.
Actually, on your last slide, just real quickly, the behavioral health demand,
Mhm.
and this is a bigger question, but did you break that out at all by age? Is that a particular age group or just across the board?
We didn't break it out in the report, but we can tell you that in some of the stakeholder interviews that we did with external partners, it was really prevalent among youth. So looking at that teenage age group, but then also as you're getting into maybe younger family age, where there's quite a bit more stress on the family, that came through. But we didn't necessarily ask that question, so we didn't have data to break that out. Great question. All right, so one of the primary key planning insights is that access challenges are not just driven by the facilities alone, operational factors such as hours or staffing, service availability, whether or not a particular service is offered at one of the sites, that is impacting access. But what we really wanted to highlight is that improving access doesn't mean more buildings. And that was that's a direction that we got, not just from the board, but also from the leadership team as well, just really trying to prioritize what is fiscally responsible as also community responsible and focus as what their priorities are. So as we look at our recommendations in the plan, we are starting with a phased approach. So it's not just everything all at once. We're not biting off more than we can chew. We're focusing on those operational improvements, things that are low to no cost, or at least, as minimal as possible. Then taking a hard look at where capital investments might be more justified in a latter phase. So not initially, not right off the bat, but really also emphasizing flexibility across counties. So again, what works for Caldwell might not work for Owyhee or Payette. And, it's part of the blessing and challenge of the district's geographic area is it does get to be very flexible in its approach and personalize that approach. And it also has to be flexible in its approach and personalizing its approach. So that's quite a demand for the organization. Any questions so far? So as we looked at this and we heard our discussion with the board and our discussion with district leadership, we really worked the plan to establish priorities for this master facility plan. So starting with increasing community awareness and outreach, and that's something that I think months ago the district had let us know that they were implementing and working on with this coming year. Strengthening partner coordination, so really looking for opportunities to either co-locate or collaborate with different agencies in these different communities where it might work to maximize space utilization in Fayette if we have another agency there that either rents or also utilizes rooms. But looking at those opportunities, expanding and standardizing service hours. So we've talked at length with the leadership team about how that approach might be set up so that they start with a pilot site and they look at expanding those hours to see how utilization changes, if it changes, and then what service demand emerges from that expansion. And those are approaches that do take more time. It's not something where you can roll out hours in a month because it does work hand in hand with increasing the community awareness and outreach and somewhat at the strengthening partner coordination. If your partners understand what you're doing, they can help you spread that message and share that with the people that visit them. Increasing staffing in high demand services. So again, this is a little bit of a follow after you've talked about the hours. Targeting facility improvements. So again, no, not new buildings. How do we make better what we already have? And then aligning space with how services are delivered. So you're not necessarily making all the improvements for Payette's location at one time. You're phasing it through these 6 priorities so that ultimately you get to a space where you can understand and evaluate how space is interconnected with the need of the facility. Any questions or thoughts about that? Excellent. So there is a section 9 in your report that talks more about the financial pieces. And as you'll note in the report, we didn't get in depth in any full comprehensive costs. Rather, what we did is we heard from some architect partners, not that one. We heard from 2 other ones that help us establish market costs now for renovation and expansion, and then apply that to some of the scenarios that we recommend in phase 10. So you can see that breakout cost. I don't have it off the top of my head, but hypothetically what that might cost for phase 1 improvements inside the report. And I believe it's section 9. But our facility strategy is reconfiguration over new construction, focus on privacy, workflow, and flexibility, and then expand only where demand has been evaluated and it can be determined that that's a necessary next step. And that doesn't necessarily mean building on or buying property. It could mean reconfiguring more inside, outside of. So for Payette, if there's ADA access issues, then maybe we look at those first 3 offices and turn it into behavioral health if that's something that's later. So that's what that means by expansion. The financial approach, the district came through with the community survey that it's perceived to be very financially responsible, came through in the stakeholder interviews as well, but continuing that practice of aligning investments with demand, being evaluative and curious in that process, prioritizing those high impact improvements. So Amanda had put together as one of the appendices, I believe it's a facility action item document that you can look at. We also tried to include that in section 10, 10.1 for phase 1 and 10.2 for phase 2. So you can see what that would look like in real life, how you might approach some of these. Really, the financial approach also stresses phasing investment over time. So not a large pocket expense, but being very, fiscally conservative in the approach, and again, more evaluative and determination. But then we also, wanted to draft it in a way that allows the district to be flexible, and not all sites, satellite sites, need to be taken on all at once. We don't recommend in our report that happens. It's very much phased, facility specific, and so you can get into that and some of those more easier low hanging fruit to take on first.
And with that too, there's the kind of the cost estimates give you numbers and targets from a budgeting perspective, but when you get into the process of actually doing the construction with the plan, there's enough detail and some outlines that you can roll right into an RFP process to bid out the actual work and use that competition to get the lowest cost possible for those kind of remodels, updates and stuff around the ADA, or even and when you get into reconfiguring some of the locations for better use set up in there.
So now getting into, this is more of section 10 and looking at the implementation. of this plan, we use these timeframes to establish near-term, midterm, and long-term, so 0 to 5 years, 5 to 10, and then 10 plus. And we grouped our recommendations into operational improvements, so staffing, hours, maybe looking at some of the services, and then moving to targeted capacity adjustments, and then long-term adaptation. And so our goal was to really, again, maximize what the district has already, aligning the investment with demand, and then ultimately supporting long-term sustainability for the district with this plan. So not something that can't be looked at in a year or sits on a shelf, but something that can be a reference and a guide, especially with that foundation of the demographic report and what's happening across the district with population growth. And as we look at aging populations coming into the district, how those services might adapt to meet the changing needs of each county's residents. Okay, so in phase one, those are the more immediate priorities. Again, optimizing use of existing facilities, piloting expanded hours and service models so that event demand can be evaluated. And I should just pause there to say, one of the things in the district's original solicitation included evaluation of demand of services. And that wasn't something we were able to capture. Part of that comes from not having consistent hours between each of the facilities, being able to understand what that true demand is. If you opened up the hours, would clinic services still be full, or would there, be a big empty waiting list? So that pilot approach, we really feel is going to be beneficial for the district and where it pilots and what it pilots. Taking care of ADA and accessibility improvements. So again, more of that low-hanging fruit, but has a really high impact on those facilities and use of those facilities, and maybe minor facility improvements. So inside your report, this is in section 10.1. These bullet points are also in there as what we would recommend to happen at each of these facilities. So at the WIC and the shared sites, improving privacy through partitioning and sound mitigation. So those aren't owned properties, but those are issues that have emerged in those sites, just sound carrying and privacy in general. Are there any questions about this slide or anything you want to add in?
Through all three of them.
Okay. Yeah, so we can walk through Emmett, all three addressing the ADA and code-related deficiencies, but in Emmett, improving reception and waiting area layout. In Weiser, reorganizing clinical support functions to improve the workflow. So the way that you have to navigate through, or patients have to get through, that can be improved. In PAEA, adding behavioral health space within the existing footprint. So if the county continues to utilize those two front offices or however that gets worked out. But that's what we mean in terms of phase one actions by site. We get into phase two, so targeted adjustments. This is more midterm, 5 to 10 years. We're redefining and reconfiguring existing space based on demonstrated demand. So after that evaluation and pilot is occurring, we're able to start implementing some of those complete select renovations or modest expansions. So within PAEA, maybe expanding the room, strengthening staffing hours and service availability in priority sites. So as they're piloting and as they're evaluating demand of service, utilization of service, do they need to have more clinic staff, whatever that looks like, more behavioral health support, and then continuing to monitor the utilization and service. So inside PAEA, reconfiguring the interior layout, adding behavioral health rooms within existing space. So a continuation of what's in phase one. Emmett, reconfiguring the interior space to expand clinical and behavioral health capacity, maybe repurposing underutilized space for program growth, and considering the addition of community space. So what we found going through the different sites is there was vacant space in each of them, depending on where we were, whether that was used maybe once a week or the frequency is different, but there might be opportunity there. And then in Weezer, reconfiguring the layout to improve clinical flow and service delivery, adding an office and nurse workspaces, and then expanding and reconfiguring service areas. So Amanda, inside her scenarios that she had presented at our previous meeting to the Board of Health, you could see how she was suggesting some of that reconfiguration of what that might look like. Questions on this one? We get into phase 3, which is the more long-term planning. So 10+ years, really focused on the long-term decisions once the demand patterns are more fully understood. So again, the evaluation and the piloting, that's not an overnight thing. That is going to be probably site by site over periods of time. And then returning to the conversation as other factors are also changing within the district as well. But you're going to be evaluating future system needs based on the growth trends and the observed demand. So the demographic report is a projection, but we feel that it's going to, be fairly accurate, but really challenging the district to, look at what's actually happening versus what was projected, and then consider larger capital investments where the demand supports it, where the board feels that direction is justified, and where leadership determines that's where it needs to go. And then maintaining flexibility for evolving service models and community needs. So again, the district has done a really great job of meeting the communities where they are. And now it's looking to enhance the quality and the outreach and the awareness there.
And within that, the kind of the 10+ years, we talked a little bit like in Emmett, where you have some space next to the building, opportunities to expand and have a larger community space for bigger trainings and events and more usable space there. Some conversation in Weezer is a little bit tricky because of the location. There's not really a lot of room, but potentially expanding backwards where the shed is and doing some additions going backwards, or some conversation about maybe a neighboring building, but that may or may not be a possibility. But when you look 10 years out, the opportunity to have that larger community space in those locations are a couple of examples that are in the report of that 10+ year opportunities to expand.
You can reference those scenarios within section 7 of your report. So if you want to look at facilities over the near, mid, and long term, you can look at more of that scenario analysis building that we covered before. So it gives you a good idea. This site for Caldwell, there's a really new building. And so one of the discussions that we've had is not necessarily changing anything, but maybe expanding the utilization of those community rooms, offering them up more to partner organizations, and maybe getting community their bang for their buck when they come in, and there's multiple services being offered in one location. So there's much more detail in section 7. And then just our final recommendation, proceeding with the phased renovation first strategy. So again, echoing back what we heard from the board and what we heard from the leadership team, optimizing what you have now, prioritizing those operational improvements, implement targeted facility investment that's needed. So this isn't let's do everything right now. This really is very phased. Defer major expansion decisions until after the district has an opportunity to really roll out some piloting and then evaluate the data that comes back from that. And that flexibility is so important as the district is growing. The largest growth is occurring here in Candy County, but there's still, relative to their size, there's a lot of growth that's happening in the district's other 5 counties that the district does have to plan for, and they're not all the same. So we did emphasize that after some feedback from the leadership team about how those services and needs need to be community specific. What works here might not work for a YE, and making sure that it's equal, but also it's equal relative to what's happening in that particular community. So, it's very phased, community specific, and first type of approach.
And I'd add to that too with those recommendations, the feedback that we got externally from stakeholders, the citizens committee, the other research that we did also supported that methodology of a phased approach and what goes into this. So being cognizant of the board and leadership as well. Also our expertise and then that other feedback played into those strategies as well. So it was a conglomerate of multiple data sources going into that approach versus, when we come into something like this, we don't really know what direction it's going to happen. Is it build a brand new building, consolidate, start adding outside buildings? It could go a lot of different directions as we're looking at facilities. And so as we went through this process, there was a lot of different feedback that fed us into this recommendation and going down this path, which frankly was a little bit different than when we first started. We came in, we didn't really know exactly what you had for facilities. We got to have some initial conversations, but which is it's kind of cool process going through that and letting the data kind of drive the outcome. Because I would not have guessed that your plan would have looked like this when we first started. I would have guessed it looked a little bit different, but you never know until you get into it and you start gathering information, really understanding what your needs are, what your facilities are, what the community feels, understanding what leadership direction and their guidance and comes into the plan. So just a little additional kind of insight into that as well.
What was really, really cool about how this all came together is it was almost like peeling back layers of an onion. We started with our facility assessments and we did our department, interviews and stakeholder interviews and the community survey. And so much to Jace's point, it evolved quite a bit as we learned more and more about the district. But, intertwining among all of those inputs, there was a lot of consistency in that feedback. So it really, there was nothing divergent about what we heard from stakeholders versus what we heard in the survey or what we observed at the site visits, which is always really helpful when you're trying to establish how a plan is going to come together. We didn't have competing areas. So it was a really interesting conversation. And then just the final point is that timing and sequencing can be refined based on ongoing evaluation and funding availability. So, our hope is that the plan gives you that discretion and the flexibility to evaluate that and not overcommit resources or anything like that. But there's an evaluative process and consideration process included in the direction that the district chooses to go.
Do you have already recommendations on what to monitor over time to keep our finger on that pulse exactly? Any metrics for?
Yeah, no, that's a great question. And I think so part of that is going to be as you increase phased increase of hours and utilization into the facilities, what does that demand look like? So the stats, a lot of stats are already kept. Do those change? So as you add hours, do you still see the usage, or does that stay consistent even though there's additional hours? So a lot of it will be monitoring the existing stats that you do already monitor and see if those change with the increased hours and availability. Something that we recommend with this too is it would be ideal, and maybe you already have it with the leadership team, but to have a facility committee that every year takes a look at this. And then you can readdress kind of a lot of the same process, but maybe at a smaller level. So you can touch base with the stakeholders again. It's been a year. Hey, has anything changed from the last time we talked as far as your relationship with the district and what's going on? Taking a look at a demographic update, which may not be every year, but maybe every 5 years. Is the growth in alignment with what we anticipated in there, or do we need to have some changes? So those demographic growth numbers are important to watch, but that's probably a little bit longer time horizon on those. And then taking those and reassessing your plan, and do you need to realign anything, make any adjustments, or keep going forward on the way that you're going? So that's a good question.
any questions or outstanding questions or feedback or anything?
Maybe I just want to say thank you to Clearwater team for working on this over the last 13-ish months, a long time, like we've been in a relationship. I also want to say, like, some of the early results were really implemented or tied into like our strategic plan and budget for next fiscal year, with investments in increasing our investments in communication resources. And then Beth and her team are going to be shifting some priorities to kind of start that phase in, and we're going to look at like Weezer first. So I think that will help us kind of start taking some of those baby steps. Then my kind of plan, now that this is kind of final and done, is to work on it a little bit as a leadership team and then bring it to our board work group as we start planning for the next year. Actually, I think we also built in some funds to address some of the ADA issues this coming fiscal year. So those are maybe 3 areas that, as you were coming, with these results, that we were like, let's not wait a year to address them. Let's start early and start now, and then we'll start planning kind of how we implement some of these pieces and evaluate how it's working.
That's awesome. I'd say in that annual review, it's also important to look at what you've accomplished and celebrate those wins, so to speak, as you start to knock things off and improve and build out the plan. Take a look and take it off. We don't, in the public service world, we don't often take a look back and say, what have we accomplished? What are the good things we're doing? We're so busy looking forward and what's the next challenge we got to tackle and the problem going on. It's good to take a look back and think, okay, we were here and we're here. We've made some accomplishments and it should be, celebrated.
Yes, Mike, I got a question. Would be, as everyone knows, these board members are elected positions, so there's turnover. So is there, the board probably needs to come up with a plan that they reevaluate every year, as you had stated, because we're doing it with Hawaii County also in Clearwater. But I see with the different commissioners coming in, they have different looks at what they want to do and where the priorities are going. So I just want to let everybody know that with different elected officials, it may change quite a bit on what you want to do. I think I've said this from the very beginning. District Health's biggest problems, getting their name out there, letting people know what they do. I think that's our biggest fallback. It's been that way since I've been on the board. It's been a long time. We were downtown Caldwell. It was probably a little bit better down there at the time, but the building was just not feasible anymore. Actually, the building's no longer there. So the move was out here. But things have changed in the valley. It doesn't matter what county, the valley's changed a lot. So what was important back then is not what everybody's looking at today. So I mean, there's a big difference in what it was 15 years ago. Big difference. So I would just let the board know that as people change, or as people are change or go into other people get here, things can change. So and then I assume that there's going to be an agreement with Clearwater to continue on with periodic, or is it going to be abandoned?
We're happy to help you. Anyway, currently we have, I think the project is the end, or the culmination of this final report is the end of the project. I think we still have like an hourly master services agreement that you can engage us with anything that you would need. So at your direction, we're happy to be in support in that.
Just that, like I say, when you have new board members come in, they're going to have no clue. about what's going on. I mean, that's just gonna be the way it is. I know of 2 new board members who will be coming in. So it's gonna be.
Hopefully the director does a good job in orienting them. I'm up to speed.
But you didn't have the conclusion on any of these, that the properties we have in our more remote locations, that's just not worth maintaining. Let's just sell that property, and that didn't seem like it.
Anything, I think we need more.
Yeah.
In today's world, it's very hard.
You know, and I know the next step obviously is to figure out how to implement all these recommendations, right? But I can tell you that in my short time in the county right now, as far as health goes, I think one of our biggest deficiencies is mental health. And if you can do something in, especially out in the rural communities where we have all these barriers to treatment, I think it would be a space where you can make an impact, and especially in our small counties. Because we have a mental health crisis going on in our country. So that's just one man's perspective.
I appreciate it. And then, one of the impetuses for me too, like going through this process, is we have, in my opinion, a healthy amount of board committed funds sitting in reserve. Those taxpayer dollars, and without a plan for them, it feels like we're not doing the best service to the public. So like, let's be, strategic, come up with a plan. How are we gonna, and I also see this a lot in government, and I wouldn't say we've been immune to it either, is that you think something's a great idea at the moment, you invest in it, and then it just kind of fizzles, right? And you feel like maybe that was the best use of taxpayer dollars at the moment. So I was really hoping that with something really intentional, that we would be able to come up with a plan that helps us guide better investments for the future across the district.
And I would add, I'm very impressed with the way you did this, your analytics, and the fact that you looked at both the operational side and the investment facility side. And there's things you can do without a lot of investment initially, and then you can gauge that as you go and redirect. And I think that's especially when we have constrained resources, small communities, small budgets, small, district. I think that you deserve a lot of credit for how you perform the study. Because I've seen a lot of facility studies over the years, and usually it's just facilities. Oh, you need to build a $200 million medical facility. Okay, where are we getting that? So, and this is more to your point, we don't have to tear anything down. We can do some modifications, increase service, do some communication. And if it grows, you build it. You keep building, that will come.
And you have a unique opportunity, and it is a little bit more recurrent investment, but especially in the rural areas, it's time and time again, the opportunities for partnership. There's a lot of folks that are interested in it. It's just having, I don't know, the individual that is coordinating all of that is following up, that is putting all those meetings together, getting everybody on the same page. And there's also a lot of grant funds too. So like that investment, even though it's an ongoing investment, but there was a lot of feedback that would have a lot of fruit as far as available facilities and through partnerships and service offerings, especially in the rural counties.
There might be some opportunities to partner with the counties too. We all have the OTIA money that you need to spend, and something like this where you're going to bring in a service that we don't currently have, and it's tied to drug rehab and counseling, and fits that model. So
District has a great model in Owyhee County at the Marsing Hub, just as potential. I mean, even just going into Homedale, there's a lot of interest in district presence there and ways it can work with the school district and some of the other agencies. So the district is not limited in that opportunity.
I know Marsing really stepping up and doing the right, and it's mostly towards what we're doing towards the youth, pushing it really heavy towards the youth. We deal with a big issue with mental health in our schools, and so are pushing in that direction. The county itself is pushing in that direction to help those children that are really suffering. And we don't have we have Terry Riley there, but they only can see a certain amount of people. That's what's causing it.
Yeah.
So it's an ongoing issue and will be for a long time.
We talked to the school district superintendent, we talked to Rob in Homedale, and they had told us that within their school, somebody needed emergent mental health care, and they went to Terry Riley, I think it was 4 months, a 4-month wait list. And so that just, just an example of the need and what they're seeing.
What's the county doing? What's the county's role in that?
We're trying to help fund anything that is around it and is going to help with the youth in schools. There's services that they're needing and that, and it's going to cost a certain amount of money that they don't have. We're trying to offset that money with money that we have set aside for things that for the future. But yes, we're doing that.
What kind of money? Like opioid money or?
No, our opioid money comes here.
Oh.
No, we're taking, like, when we got some ARPA funds, we use some of that. We also get Pelton, so that's, we spend 65% of our Pelton goes into the general budget. The other 35% of it goes into, basically, we have it committed for other entities, usually for building, but we committed. But use it for other stuff, and we can use it for other stuff.
Nice.
Well, I mean, I would much rather have the federal government land, private land, because we get about 5 to 6 times the amount of money we get, but it is what it is. We have 4.66 million acres and 17, less than about 15% of it's privately owned.
Are there any other questions or feedback? Thank you. It's been a pleasure.
Thank you. You're gonna miss this when you're gone.
I still got you. But I'm from Caldwell, and so I'm always looking for a reason to come out. So if you just want me to come hang out, I'm happy to.
We really appreciate you have a great staff, a great leadership team, and you've been a great board for us to work with. So thank you for letting us be a part of this project.
Thanks so much.
Thank you.
Thank you.
I'll have to say, you're like right on time.
You did it. Oh, don't mess it up.
I know. It's like, okay. These are all verbal. Well, I shouldn't say that. The director approved agreements, contracts, and grants are like normal. They're back in your board binder if you have any questions. Just a reminder, we'll be sending out budget committee proxy forms for the budget committee meeting next month. So if you are not the board chairman of your board of county commissioners, then we'll be asking for a proxy unless your chairman wants to come. I already talked about solid waste nuisance, so I won't. About time for me to receive feedback from my performance over the last year, compensation. So I just wanted to get any input from the board on what process you would like to see for that this year. Last year, you opted to have input from my direct reports. Prior to that, I think we did some surveys to board members and got input from direct reports. And then our HR person, JD, collects all of that and gives it to the board chairman. So those are just kind of how we've done it, but ideas or the other.
You and I think about it a little bit. So
No.
you have a
My,
preference?
in the past, when the commissioners have done feedback or has not been well anticipated in. So last year, we just asked for the staff, leadership staff, and the staff to give us their impressions. So we had a full gamut of the employees here, of the director, and she was leading. So I like that myself personally, but I'm open to whatever I like to do. But that's what I would, my thought is just to have the employees give their response on how they feel Nikki's doing.
I would agree, because you get more, there are more responses, and it's a little bit more robust.
So moved.
I will have Jody initiate that process and then share the input she gets with Chapstream. The next item on the agenda is the integrated community mobile care. So last month we had Washington County present, I missed it, on the paramedic program that we're helping support. And just wanted to give you an update that we're continuing to kind of prepare for rural health transformation grant opportunity and to apply for that. And we've looped in some state partners in those conversations. We have a meeting coming up. Maybe I did already, but it's like the end of May. Yes, yeah, end of May. With Idaho Office of Idaho Office of Emergency Management. I don't know if there's still a bureau, but Bureau of EMS. And in part because what I wanted to try and avoid is a whole bunch of like competing funding opportunities, funding applications for the same things. So trying to get like a larger conversation going on how we could better support community EMS, how we can kind of upskill them in capacity with behavioral health supports or other services, which I've shared with you already, so I won't delve into that again, but just wanted to let you know we're continuing those conversations.
Before we move on from that, I was talking to our paramedics chief, and I guess this never really clicked with me before, but he said, because they piloted this in the past, very effective, they like it and everything, but the problem is that they can't bill for it. So after the project sunsets, there's no way, I mean, they can bill for ambulance transports and all of that. Medicare, Medicaid doesn't pay for it, insurance doesn't pay for it, so it falls completely on. Even though it diverts people out of that emergency system, potentially could cost more.
Yeah, you're assuming costs without being able to get
Right.
reimbursement for it.
Is there any way to address that?
That's been part of the discussions. I don't know that we found a clear answer. The state, I think this was maybe in their appropriations bill that approved the rural health transformation grant, that there will be no Medicaid waivers or state plan amendments related to this, which kind of hamstrings us in being able to pursue something like that. So, so to your question, I don't know that we have a clear answer, but it is something that we're working on. And there are some kind of ancillary services that I think from a public health district, we have the infrastructure and ability to build for, but I don't know if it would, cost savings would be there. So
That's really got to be part of the long-term.
it does, yeah.
Establishment, something like that.
So could we use opioid money for that?
You could, but it's not long-term again. You
Right.
Got about 15 years. And that
Better than nothing.
it's true. It kind of fixes it or holds it maybe right now if you have enough to do it. But
Yeah, that might be an issue for us. We don't have a ton, but
Yeah,
it's not
that much.
Yeah.
we also, I mean, we've talked internally about, and we also have some opioid settlement funding. And I also think we could, for especially some of our more rural counties, we could probably share resources across county boundaries. And I don't know if that would you might know better than I don't know if that means like the district would kind of have to be the organization over it for those cross-boundary services to function.
Probably.
Yeah, or have some kind of, yeah.
Cooperative agreement.
Yeah, in place between counties. So those are just some ideas that we've thrown around. But I think if some funds were pooled together, then, or we shared resources across county boundaries to support EMS services through like community paramedicine or some of those other like transitioning out of jail with behavioral health issues, some of those other services that we've talked about, then that might help sustain it better long term than trying each ambulance district trying to sustain their own.
Yeah, that's got to be a big part of the whole plan.
Yeah.
Yeah. So
And long-term sustainability is important, but one thing I've learned working in government for a long time, I tend to think of things in like 5-year blocks. You know, if you can continue it for 5
I'll be
years.
gone by then.
Well, it's not that. If it is a success and it's impactful, it will get resourced, right? So if you have funding, it may not be forever,
Yeah.
but if you have enough that you can make a program survive and determine whether or not it's viable, then it will get resourced because it will show its, right, its value, and then value gets rewarded.
Right.
So
And a lot of these grants are 2 years, it seems like.
that's not enough time. You gotta have more money than that. Because 2 years usually isn't enough time to get something rolling, but
especially if you're looking for.
But opioid money that lasts for 15 years, as long as it continues, which I think it will.
But we just got another.
Yeah, we did too, but I'm just saying, you know, you can look at those short, you know, midterm type resources. It's not a 1-year appropriation or a grant that's going to end in 2 years. It's something that is sustainable for a period of time. And then you have time to flex and change and evaluate. So just something to think about. And I think collaborating, we have opioid money, you know, we have a committee that we established like everybody. I'm looking for value out of that money, right? And mental health is like at the top of the priority list. So if we can figure out a way collaboratively to do that within our district, I think that would be a huge win. And if we share resources in the smaller counties, that's even better.
I actually suggested that to Michelle when we talked about this justice thing, that it might be
Let's have a
couple of
workshop
counties
about it.
maybe, because we might have not have enough people in our justice system who would meet that qualification, but we can look at that regionally.
Yeah, I think we have better connections with some partners in the counties than we do with others, and trying to like find the right people to help support those or be part of those conversations.
And you have to, you know, prosecutors function differently, sheriffs, yeah.
So it's hard for us to act timely enough when funding announcements come out. But, you know, we've been trying to foster those relationships so they can move faster, and we're getting there. But
it's hard to create something if you're talking about using the justice fund and the ambulance fund too at the same time, because they're all hamstrung.
Right. They all have their requirements.
Yeah, but they're financially, like a lot of I know our ambulance district is, but the justice fund is always maxed.
We don't have a district, but our EMS is like everybody upside down. And making up.
Fingers in the faucet.
Well, and most of it's because of reimbursement rates.
Yeah.
That's an election, you know. You don't get reimbursed for the cost, and then you can't collect some, so you're negative.
But when you do, you're 90 days out. Or...
Yeah, our district just, it's not, our county EMS just hired a collections company to help with that, and it's actually paying off.
Yeah, we do that too at a billing company.
Yeah, they're getting, you know, our outstanding is going down and our rate of recovery is going up. And
we have a billing
company to bill.
A billing company and a collection company settling up. Yeah, dealing with Medicare, Medicaid, and all the insurance companies.
And
it's just.
Okay. Yeah, Medicare, Medicaid. Oh, you're just not going to pay anymore.
90%.
Yeah.
I don't understand.
And some of it, but the insurance companies, the way I understand it, if it's coded wrong, if you're one number off or something on it, they kick it out. They don't say what it, you know.
That goes for everything.
And it goes back into the windmill again for.
Yeah.
Sure, we digress. Go ahead.
You're really trying to make me be late, aren't you?
Yeah.
We don't want to get on coding. That could be an hour conversation.
Yeah.
Okay. I've already touched on the staffing challenges we're going to be facing here in the short term for subsurface storage. So I won't belabor that. Just be, if you do get calls from constituents that are a little upset, if you can't hunt them down, feel free to send them our way. But just understand for a period of time, we're going to be a little stretched. And then the last item on here is just for your awareness that Commissioner Purdy's term's coming up, so we'll be sending out ballots for.
How long is a term?
It's silly that that doesn't coincide with.
Change that.
This was this was actually, Bill 316, this was the state of Idaho. Counties were a minor part of that. Did Bill 316, which all be working at the counties are going to get. But we end up having to go back to Indian charity to help fund Medicaid. But anyway, when the counties took over, we didn't change any of that. Terms aren't the state, it was always been, even though you have two commissioners have a 2 and 4, 2 and 4, none of it adds up. But unless you stay on the board for 16 years.
Right. So how do you do that if you have a term limit of 5 years?
There's no term limit. It's just, you get
Just
reappointed.
They just get reappointed. The next set of commissioners would come in and just say, well, you've been doing it, do it.
Yeah.
And then we don't need an executive session. Sorry, I skipped future agenda items, but
Just that, this whole bit, because of how much it takes to train surface sewage, police don't lose any of the others that we are, because it takes, it can't, when we're training, there's 2 guys going out. So that guy is, the guy that's training is only limited to doing what he's already able to do. And then he's training somebody in the meantime, at the same time. So that's why we get these backlogs. Like we had a couple of years ago, we had backlogs, but it was turnover rate was terrible. I think this was more about where the person lived and so much about being here. I hate coming across the river, so I get it. In my way, there's like toll booths.
I was gonna say, when did we put one of those in?
Well, I want to thank everyone for their time, so appreciate it. And it is 12:52. You're adjourned.
11.
11. Sorry.
You did that on purpose.
Some hours. Somewhere.
Somebody else.